Mariah Carey says she is being treated for bipolar disorder. The singer says she didn't believe it when she was first diagnosed after being hospitalized for a physical and mental breakdown back in 2001. The 48-year-old singer says she lived in denial and isolation and feared that someone would expose her. I'm joined by Dr. Erica Richards. She is the chair and medical director of the Department of Psychiatry and Behavioral Health at Sibley Memorial Hospital. Appreciate you taking the time to come in and talk to us about this, doctor. So Mariah Carey has been diagnosed with this bipolar disorder. First, can you tell us what that is, and then what's the difference between bipolar 1 and 2?
Sure. So bipolar disorder is a mood disorder. What that means is that it essentially affects our mood. It's characterized by both depressive episodes. So people have heard a lot about unipolar or major depression. So those depressive episodes are very similar. However, bipolar also contains elevated moods, which we will call hypomania in the case of bipolar 2 or mania in the case of bipolar 1.
Okay. Now, how could anyone tell the difference? I mean, I think we all, as humans, have mood swings. We're excited and happy one day. We might be just kind of, I just want to phone it in on the next day. So what characterizes the difference between mood swings and bipolar disorder?
Right, so that's a great question. And the main thing that we're looking for are disruptions in your life. So correct, everyone has a bad day, and we're not talking about bad days. We're not talking about days where you're excited or your mood is elevated. But essentially, these hypomanias or manias, which in the case of bipolar 2 can also be characterized by irritability. These are typically affecting your daily life, either by arguments with people or getting into trouble, be it with police or be it with your employer, but it's really disruptive to what one would consider kind of their normal daily experiences.
So for her to come out and initially say she was afraid that she would be exposed, and now for her to just come out and say this on her own, why do we suppose that it's taken this long, and what purpose? I know you don't treat her, you don't know her, I would assume. What would spur her to come out and do something like this, and this would just be speculative?
Sure, of course. Well, again, since I don't treat her, I can talk about in general.
Sure.
Why do people come forward and talk about this? And I think that what we're seeing, especially amongst celebrities recently, is that people are understanding that this is an illness, that unless we're talking about it, and now even for mental health in general, if we're not talking about it, if we're not opening the dialogue with friends and family and other people where we can tell them, listen, this happened to me, it's okay, let's talk about that, because the biggest thing is that there's treatment. And unless we have the proper diagnosis, we can't begin to talk about treatment. But talking about it gets us to the point where we can investigate which treatments will be best. And there's absolutely hope for people that are considering whether or not they have this disorder, whether or not they have a mental illness. There's appropriate treatment.
Let's go down that road. What kind of treatment is it? Is it medication? Is it counseling? A combination of the two?
Essentially, it's both. So what we know is that there are medications that will treat bipolar disorder. Typically, people will hear us say mood stabilizers. And essentially, you know, and what's normal, but if we consider this to be around a normal mood, then what mood stabilizers will do is try to keep people's mood from being too elevated or too low. And so mood stabilizers would essentially be the first medication that most doctors would recommend. However, with bipolar disorder and most mental illnesses, what we know is that a combination of both medication and therapy are what seem to get people better quicker and to help keep them well moving forward.
And last thing for you real quick, doctor, when something like this comes out, when a high profile celebrity comes out with something like this, do you see a spike in the number of people questioning, coming in, saying, I think I might have this?
We do, we do. And I think that the number one thing that I would encourage anyone to do is to talk to their health practitioner.
Yeah, starting the conversation.
Certainly start the conversation. This can be a family medicine doctor, this can be anyone that they trust to actually talk about, well, here's what I'm experiencing. Is it just a bad mood? Is it just sadness? Or are there other things going on? But what we hope is that this does open the conversation up for people to really investigate whether or not this might be one of their diagnoses, so then they can move forward with treatment.
Yeah, if there's something serious going on affecting your life, talk to somebody about it. You could be better off on the back end. Dr. Erica Richards, thanks for coming in to talk to us.
My pleasure. Thank you.
Coming right back.